Welcome to the Rose Centre for Stroke Recovery and Research. Made possible through the generosity of the Rose Family Trust, this custom-designed facility houses the University of Canterbury Swallowing Rehabilitation Research Lab as well as the rehabilitation clinics, ensuring a smooth transition from empirical research to clinical application. Best practice in health service delivery is only best until it is bettered. We aim to push the limits of best practice and develop new standards of care for patients with disability following stroke. Our patients are sometimes our best researchers. With clinics on site, we aim to provide clinical services that meet the patient's needs, but allows those patients to guide development of research protocols through their experiences. Finally, working closely with non-clinical colleagues in engineering, we will create new, innovative technological applications that will facilitate recovery by allowing greater access to intervention techniques. Come with us on a walkthrough of this new facility. Our imaging laboratory incorporates the best of clinical instrumentation with the best of research instrumentation. Video fluoroscopy is a technique that allows us to capture a motion picture X-ray of swallowing. This movie enables clinicians to diagnose the nature of swallowing impairment and allows researchers to measure specifics of biomechanical movement. Our X-ray images can be recorded simultaneously with other instrumentation that demonstrate, as seen here, how pressure in the throat relates to movement of structures as the food travels from the mouth to the stomach. This instrumentation measures not only pressure in the throat and mouth, but can also measure muscle activity, breathing, and the sounds of swallowing. Using neuromuscular ultrasound, we are able to visualize the muscles of the tongue and jaw and measure simple biomechanical movements. A great benefit of ultrasound is that it is non-invasive and can thus be used repeatedly as a biofeedback modality in treatment. If we leave the imaging lab, we can see another clinical room directly ahead. And if we turn the corner, we find the physiology lab. This room houses a number of tools for measuring aspects of swallowing. Karen and Claire are demonstrating a software program and treatment protocol developed in our laboratory that works on precision in swallowing. Using muscle activity as a form of biofeedback, the patient is asked to hit a target by controlling the muscles involved in swallowing. Video endoscopy is a technique in which a small camera is inserted into the throat so we can see a live image of the inside of the throat during swallowing. In this image, you can see the vocal folds and the airway. Thus, in patients who do not swallow well, we can determine if food goes into the lungs. The Rose Centre has the newest technology that can be applied to patient care and clinical research. This equipment records pressure in the throat from 32 sensors during swallowing. The coloured images on the screen represent 3 swallows, with warmer colours representing more pressure and cooler colours representing less. This technology can be used to diagnose swallowing impairment, but also used as a biofeedback method in treatment. Understanding how the brain controls behavior and how we can control the brain in rehabilitation is a major focus of our work. Using equipment such as this, we can activate neurons in the brain using a magnetic pulse. Measuring how quickly this activation travels to the muscle can provide information about how our treatments influence brain function. We can then apply treatments directly to the brain that will enhance brain recovery. A major success story in our research program has been implementation of a cough reflex test in identifying swallowing impairment. Inhaling a mist containing citric acid will make a healthy person cough. Stroke patients who do not cough in response to this test are shown to be at high risk of developing chest infection. As we leave the physiology lab, we now enter the brains of the Rose Centre. This central work area houses Rose Centre professional staff and postgraduate research students. We support and are supported by up to 14 University of Canterbury research students. These students provide excellent clinical care under the supervision of our clinical director and discover new insights through empirical research to guide rehabilitation and will ultimately carry the aims of the Rose Centre into their own clinical and academic careers.